wanting to get pregnant but has never been successful? Then this video is for you. Hi, I am Dr. She Armero and you are watching Doc She TV. Today, we are going to talk about the factors that warrant investigation when you are suspecting infertility. I had two patients, both are best friends, Liza and Rose, of course, these are not their real names, came to me seeking for help because they would want to get pregnant. They got married at the same month last year and had been trying to get pregnant. And so, they came to me, I counseled them, and taught them how to get pregnant. I also made a previous video already on the 3 easy steps. And so, more or less, it was about just like that. And 2 months after, Lisa already had a positive pregnancy test. While Rose, she noted irregularity of her menses. And so, she came back to me and requested for a re-evaluation for her and her husband. Did you know that in a group of fertile couples, meaning among couples who constantly have a regular sexual contact, their monthly ability of getting pregnant, or we call it fecundability, is only 20%, meaning the chance is only 20 out of 100. This fact is very important for all couples to remember, especially the ones seeking help for fertility in order to meet unrealistic expectations. And so, once again, even among normal fertile couples, there is only 20% chance, unless of course, in vitro fertilization has been done by these couples. And so today, I will be going to teach you the 5 factors that you should consider when you are suspecting infertility or subfertility. What are these factors? Are you familiar of the vowel sounds? The A-E-I-O-U of infertility. The first, age. Infertility is the inability to conceive after 1 year of trying. This is only applicable among those women in the reproductive age less than 35 years old. However, when you are already 35 years old and above, your waiting time should only be 6 months. And if you have been not successful for 6 months, then it's time to seek for help. Again, the first, age. Age of the woman. The second factor is for endometriosis. Endometriosis is the presence of endometrial glands and stroma outside of the uterus, meaning the lining in the uterus supposedly should stay there in the lining. It should not go out. So for women with endometriosis, there are 2 factors or mechanisms that contribute to infertility. Number 1 is the adhesions brought about by the endometriotic foci or the ectopic glands, endometrial glands and stroma, which causes inflammation in the area. That's the first mechanism. And the second mechanism is the immunologic factors. There had been distortions or presence of antibodies in the endometrium or in the lining of the uterus that causes difficulty of the implantation of the embryo. And so, this possibly causes the infertility. The third factor is irregularity of menses. Now, irregularity of menses is the most common sign of ovulatory dysfunction. Now, ovulatory dysfunction is among the most common causes of infertility. This accounts for around 20 to 40% of it. Now, one of the 2 most common causes of ovulatory dysfunction is polycystic ovarian syndrome. Yes, the very famous PCOS or PCOS. And you're right, I also made a video on that already, which you can click also in the description button below. Now, apart from PCOS, the other causes of ovulatory dysfunction can be a sudden change in weight. Either you just bloated, you gained so much weight, or you just lost so much weight, or you were under severe stress lately. And so that can cause irregularity of your menses. Now, the fourth factor is O or tubal obstruction. Now, in tubal obstruction, this can be observed among patients, most commonly those who suffered a previous sexually transmitted infection, or in the dialect, SIRA. SIRA causes an irreversibly damaged, inflamed, obstructed fallopian tube. This prevents the transport of the sperm towards the awaiting egg. Now, let's just say, what if the sperm can get through? Now the question will be if the fertilized egg can get through. Now the next problem after infertility will be ectopic pregnancy in cases of tubal obstruction brought about by previous sexually transmitted diseases. Now your next question would be, is it only the sexually transmitted diseases that will cause tubal obstruction? Well, it can follow after a pelvic surgery from an endometriotic cyst, of which I have also mentioned the mechanism of endometriosis in factor number 2. Also, after a surgery of the appendix or the appendicitis, you had appendectomy. The appendix is very close to the right fallopian tube, which can also cause inflammation in the area. Or especially here in the Philippines, where tuberculosis is very common, a patient may have pelvic tuberculosis that can cause inflammation also of the tubes. And so these are the possible etiologic agents or the possible causes of tubal obstructions. Now, the fifth factor is U for letter U, uterine factors. Now, the presence of myoma that distorts the lining of the uterus, we call the submucous myoma, can prevent correct implantation of the fertilized egg or the embryo into the lining of the uterus, and so it can also cause infertility. Now, for a myoma just located outside of the muscle or outside of the lining, it does not cause or it does not contribute so much on infertility. But another uterine factor that can be found also in the lining of the uterus are endometrial polyps. It was also noted that endometrial polyps contribute to female infertility. And so once these are detected, we recommend these to be removed to improve fertility. And so we should remember endometrial polyps, submucous myoma, and one more, especially among those who had a prior history of abortion that needed curettage. You need to remove the products of conception inside the uterus. If there had been so much scraping of the lining of the uterus, it can cause scarring in the lining, causing the adhesions. And so that can also be a factor of infertility. And so once again, the 5 factors are the A-E-I-O-U of infertility. A for age, more than 35 years old. E for endometriosis. E for irregularity of menses. O for obstruction of the tubes. And U for uterine dysfunction. If you have these 5, do not hesitate to visit your nearest obstetrician and gynecologist. And if you would wish to interact with me virtually, do not hesitate to reach out in our official Facebook page, Dr. She Armero OBGYN Lifestyle Clinic. so I would be able to advise, guide, and be there for you in your journey for fertility. Once again, this is Dr. She Armero, and you are watching Doc She TV, your way of life. And if you would wish to have or to be notified on future videos, do not forget to like, share, and subscribe. Till the next video, bye!
Oh, let me up with a bright smile on now.